Okay, so for this one, just like we did with the scapula, I'm just going to cinch you so that your shoulders are back a little bit and your hips are slightly forward. So just like I did with the scapula, I was here. I'm going to do the same thing when I'm working on pelvic posterior elevation, anterior depression. Okay. What I'm going to do to make it a little bit more functional so patients understand what you're doing is I will usually take a pillow and I'm going to extend this leg and have you just rest right on here. Okay? Because if you think about that stepping and where you actually use anterior depression, posterior elevation, is that control as you're going to put your leg down. Okay, so now it makes a little bit more sense when I'm telling her to let things go. It's like we're going towards that heel strike. Okay, so what I'm going to do here is I want to make sure you're in a good neutral position. All right, I'm just going to roll this up so they can see it. Now, I don't really want to work on having her push up into posterior elevation, especially if she's a sensitive back patient. If I start resisting her pushing up, she can really get some compression in her lumbar spine, and that's not something that I typically need to work on. And what I mentioned with the posterior elevators, that's really just a stabilizing contraction. We don't need to hike up and work on pushing in that position. So the way that I'm usually going to work on this is eccentrically trying to control those posterior elevators. Okay? So if I'm right here, I'm facing that diagonal. Okay? I'm going to have my contact just on the posterior superior aspect of her crest. Okay? And what I'm going to do, let me just roll this up so they can see it. Good right there. Fine. Okay. What I'm going to do is ask you to just hold this position. So we're going to work on an isometric hold as I'm going to try to push your pelvis down that way. So I'm going to do it just with one hand just so you can see it and I keep the rest of my body out of the way. Okay? So I want you to just hold it. Don't let me move. Okay? So she's starting to stabilize right here with her trunk. Okay? I'm going to put this hand right on top, and I want you to keep holding here. Good. Now, just let me slowly bring you down a few inches. Good. And now just slightly push up a little bit. Come up and hold it there. Again, I'm not going to take her to end range where she's getting into a lot of lumbar side bending. She's just working at stabilizing here. And the key is this eccentric lengthening. So now just slowly let it go. Good. And now just slightly push back up and hold it. And slowly let go. So I'm working on that eccentric control of her posterior elevators. Okay, so she's able to control that leg as she's going back down. Okay, that's really the only direction that I'm going to work. There's not a lot of times where you have to push the leg down, and you're not stepping and pushing like that. It's controlling the leg as you're lengthening it down. So with this pattern, we're almost always working eccentrically, or isometrically and eccentrically. Okay, does that make sense? So again, she's in about a mid-range right here, and I'm trying to push her down that way. So hold it here, don't let me move you. And she kicks in right there nicely. Now just let it slowly go. Good, and slightly push up a little bit and hold it right there. And slowly let it go. So we're still going over that bowl. Okay? Now, so I'm actually getting some more range in her QL and in her trunk right here. Anytime we get more range, we want to be able to strengthen in that range. So I can work on her anterior depression in a couple different ways. Okay? I can either, once I get her all the way down here, this grip's a little bit tougher, but I can come just above her greater trochanter and try to pull her back towards me. So if I get her all the way down here, see how I've got you down there? I want you to just keep it here and don't let me pull you back up. I can just go lumbrical grip right on her greater troch and have you hold it here. Don't let me pull you up. Okay? Let me slowly bring you up a little bit. And now try to push your heel all the way down away from you. Reach that leg down, reach down, reach down. So she's trying to lengthen that leg down. Okay? Well, I'll do this more when we do the leg, but I'll show you functionally how I use this a lot more. Okay? So a lot of times, I'll come right here and do it. Okay? So if you think about trying to control that leg going down, you're keeping that foot in that dorsiflex position. You're in that lower extremity pattern that we talked about. So I can have her bring her toes up right here, and the same thing I was doing from above there, I can resist her right here. So hold, don't let me pull you down. And she's kicking in the same way. Okay, now let it slowly come down. Good, and slightly pull back up. Good, hold it. And let it slowly come back down. Okay, so you'll see it again a lot more when we do the leg next week, but I just want to show you how I use this. So for that patient that hits their heel real hard or has that foot drop, they can't control it, that's that eccentric control of your anterior depression, posterior elevation pattern. Okay, but for the sake of practicing it today, let's just work on getting in this position. We'll just take like 5 minutes to do this one. We'll get into this position. We'll work on just getting them into a mid-range neutral position, having them hold it here, don't let me push you down. And you can see when all those muscles engage right there. And then just work on that eccentric control of slowly letting it go. Okay, to get some more range in that lumbar spine, especially in that quadratus.